Okay, and let's start our town hall meeting. And I'm so happy to see so many little boxes on my screen, so many people who are joining in, um, and this really speaks to the community that we're trying to sustain right during this time, and so we're really happy to be together. Period. And so what we have in mind for today, everyone, oh, and by the way, my name is Mike Fogel. I'm the president of PAATA, broadcasting from my basement office, where I've been doing a lot of telehealth too, and admitting everyone as we go. So what we would like to do today is really to create a forum for communication and listening, and we scheduled it to be up to an hour and a half. Of course, if you need to leave to support someone in your house or for an appointment, some other kind of appointment, obviously, we're just glad that you're with us for any amount of time. Feel free to jump in or jump out, or vice versa. We also, I think it would help if you can mute yourself and then unmute yourself if you want to talk. That would be helpful, so that we're not talking over each other, and if we don't have background noise, or if you have dogs barking in the background. I think we're all so we'd love to do that. Have everyone muted, then unmute yourself. And so I thought, and maybe with your feedback, the two main ideas that we tossed around for today is, one, just giving a space to speak and be heard by your fellow art therapists, where we will understand you and your plight, right? We are your people. And so just a place to be and be together and be heard. We can all hold each other's stress and challenges. And we could also do it and then generate ideas, whether if you've come up with various creative ways to engage with clients via art, visual communication over this telehealth medium, that would be something else that we could do. And we're open to other thoughts and communications that you have as well. So I don't know if people want to have sort of the event session and then later make it sort of a brainstorming, or if we want to just make it flow. Any feedback? What do you think would be the most effective way to do that? Anyone have a thought? You want to unmute yourself or give a suggestion there?
Mike, I wonder if you could just give an overview of the things that we've been doing, and then also talk a little bit about ideas or problem solving related to the self-quarantine and support that people may need in problem solving that. Okay. If that works.
Maybe first I'll just give a little update on what PAATA is up to and was up to. If you'd see me looking away when I do this look away, it's because I'm admitting people to our meeting. So the focus very much for this board of PAATA over the last year and a half really has been stabilizing membership, regenerating engagement, bidirectionally, really having the board and PAATA provide value for the members in terms of educational opportunities, networking, of course, the licensure movement as well, fun and support. And so that's been the main sort of overarching focus. And so in the last year, we have been doing a bunch of events, educational events. Some were half day. We had a couple of full day symposia. And something that sort of emerged out of the licensure movement was the awareness that PAATA, which used to be the Delaware Valley Art Therapy Association, is no longer just a regional or parochial association. We really needed to represent and support the entire state, especially because of the urgency of the licensure movement. And so that led to a name change. So we changed it from the DVATA, Delaware Valley Art Therapy Association, to the Pennsylvania Art Therapy Association. That occurred last summer. Formally, we finally got official word from legal powers that was confirmed. So, so that was what was also going on. And so we are now the Pennsylvania Art Therapy Association, and we've really tried to embrace the whole state by appealing to people from around the state to join the board. So we have people who have now joined from, we have several board members from Pittsburgh. We're trying to reach out to other parts of the state as more board members roll off. Come this December, there'll be a bunch of new openings. We'd love to have people from around the state to represent your area. And also, one thing I think that lapsed over the years was our engagement with students. And knowing that both students need support from their professional organization. Students wouldn't know if there was any value if we weren't providing value. So reaching out to them, and we still have a virtual event planned for May 31st, which is a jobs, sort of an entry into the professional world day. And we've been asking students for their input through our PAATA student representatives. We've made great efforts to reach out to every school in the state that has art therapy, whether at the grad level and undergrad as well, so that we have representatives from those schools so that they can attend the board meetings and then go back to their peers, their cohort, and report on the doings of the professional organization, and then vice versa, polling their cohort and their peers for what they need in this present day climate of students heading to the professional world. And so we just, we treasure our students. We know that you are the future of art therapy, and you're also the future of the association. And so we really have been really appreciating that partnership. We had a major conference planned for the last weekend of March. And of course, that was right when the coronavirus struck our region. And so we needed to cancel that. That was the beginning of social distancing. And so we've rescheduled that for next spring, next March, and that will be up in the Allentown area. We're going to partner with Cedar Crest College for that again. We're going to co-sponsor that. And we have been discussing doing some fall events, educational events also. And now we're just waiting for a little more guidance to know if we should go ahead and plan them. Guidance, from health officials and from our leaders. So stay tuned for that. Let's see, Michelle, would you add anything in terms of the PAATA update?
We had been working on some licensure efforts, which also have been suspended because of our need to distance, and we have been doing a lot more outreach. We've done those networkings and also our salons, and I do hope that if you're not a member that you join our membership. We also send out our quarterly newsletter that Minnie Jacobson works on and diligently puts together for us that has lots of updates and information. So although it may seem long, it's packed with information that I hope that you can take a moment to look at, stay up to date. We're always looking to feature art therapists, so we hope that you can participate in that. We also want to hear what you're doing so we can highlight all of your efforts, not only in our newsletter, but also on our website as that becomes available as the in the appropriate sections. So as you have information that's available. So yeah, we're really focusing on being diligent of giving back to our membership and also mentoring the next generation of art therapists to continue to provide leadership for our statewide chapter.
Right. A couple other things that popped into my head. One, on our website, we do have a listing of if you provide ATR supervision, and we also have a private practice list, and we will help you market those services. So contact us with your information. We'll tell you, you can go on the website, and we have it by region. So even if from whatever part of the state you're in, you can get listed. And we have the state broken down into regions and listed both alphabetically. And so people in your area for the services. I want to make sure that we mention that too.
I wonder if you could remind people to mute themselves. It sounds like there's a lot of rustling in the background. Maybe some people who've just joined us are not yet muted.
Yep. I can also mute all. So one more update is, and another service that we provide for the community is every other year we do a jobs research study and a salary study, and that was completed. We had over 100 respondents to our survey, which is great response rate for this year. So we should have great data. It's all but completed, and so hopefully this spring you'll be seeing that. So if you are looking for a job or supporting a student who's going out into the field, you can share that. Let them know what the going rates are for art therapy, so they can better negotiate. They have actual data to base their applications and their salary negotiations on. So, two more things. So at this point, a lot of business as usual is on hold, but therapy goes on. And so we'd love to speak with you about, maybe we can start to talk about what each other's experience has been during coronavirus, during social distancing, and trying to still provide treatment. And so, again, this is this is sort of a public forum. It's not really confidential. So, be sort of intentional about what you share, right? And also, as a reminder for anyone who came on a little bit late, we are recording this so that people can also view this in the future, okay? So with that, I'd love to open it up to the floor, and just individually you can unmute yourself, and we'll converse from there.
Hello? Can you hear me?
This is
Rhonda.
Make sure you identify yourself, please.
It's Rhonda Stern in State College.
Hey, Rhonda.
Hi. So I guess I'm 64. I'm not into telehealth. So I had about a week of just kind of feeling like giving up. And then of course I didn't for lots of reasons. And I am now probably 3/4 as busy as I was before this happened, although I haven't started new people yet until I get on a program. I'm working with Simple Practice to be able to get paperwork signed and everything. But I'm particularly interested in any ideas that people have on a practical level for using art therapy, and I'll share for a minute what I've used so far. So maybe people have other ideas. I've used Zoom, of course, and I have observed people doing artwork. So they'll sort of lower their laptop so the camera is on their hands, and then I get to watch their hands. And these are people I already know, so I don't need to also see their faces all the time. And I allow times of being quiet while they're working, because you feel like you have to talk all the time when you're on Zoom. I do sort of, but then I'll say we can have 10, 15 minutes of silence and you go ahead and work and I'll watch you. So that's worked pretty well. And I usually work in a way where we talk, even when people are here, we talk for a while, and then the art kind of naturally evolves from the discussion. And I work with all ages. The other thing I found is on Zoom, the whiteboard allows for interactive artwork. It's very primitive, but kids love it. So they can draw and I can draw. So the whiteboard on Zoom has allowed for some interactive artwork, but I'm particularly interested in any apps or anything that allow for higher quality interactive artwork maybe, or just any other sort of technical options. So that's my main interest today.
Right. Thanks, Rhonda. Thanks.
You're welcome.
Great question. Anyone have either identify with what she's saying and also have any solutions that you found? Jet?
Have you tried the share screen to show anything that you have on your computer with your students? That's something I've used to do. We did the first group that I led, starting with Zoom, we did mandalas. So I had already on my desktop some mandalas to show as an example. Have you used that?
No, where is that
share
option?
Well, down below you'll see it. It's red, green. I'm sorry.
Oh,
it's green. It'll say screen share or share screen. Sorry. And
that's
that
where the whiteboard is. Yeah.
Is that what whiteboard is?
Yes. So you said it's called share
screen.
And then what do you do once you hit share screen?
Then your desktop on your computer will come up, and if you already have the photograph from your photographs of, let's say, a mandala, I'll use that as an example, it will come up instead of your face on the screen, the mandala will appear, so that the your participants will see, oh, here's a mandala or something else. So last week I did, the emotions chart pie thing with all the sections, and we did the same thing. I had a few samples, so I could talk them through it. They could visually see what that, dividing the paper into 8 sections for emotions.
Okay, how does it appear? Have you scanned it in or something already?
Yeah, it should already be, like, let's say you found it on Pinterest or something, and you have it in your photos, you have it on your desktop, you have it in a file. I have an art therapy file. I'll pick up my art therapy file, and then I'll make sure that it's on the desktop, on my desktop.
Okay.
If you have to go into a file and then pull it up and then have it on your desktop while people are, waiting to see it, that's kind of not a great thing. So it's better to have it ready, and there it is. So you just click on share screen, and boom, it's on your desktop, and everyone will see it. So that's the technical idea.
That's helpful. You can share any screen, including a website, so once you click share screen, it comes up and you can select your web browser. That comes up, and then you can show a YouTube if you need to. So you can share any application that you have open on your computer. Once you click share screen, you can see options. You click on that option, and then it fills up your viewers' screens with whatever you have up.
Does that work for PowerPoints as well?
Mm-hmm.
Yes.
Thank you.
So I had a couple of things I wanted to add. If you're a member of the American Art Therapy Association, on the 14th of April, there was an email that was sent out to the entire membership that consolidates a lot of resources for art therapists in conducting sessions online. They have multiple blogs that are available, and in their email message that came out on the 14th, they talk a lot about how to transition to sessions online. They talk a little bit about different resources that are available, like DoxyMe. And then for some of you who are aware of the HIPAA compliances for online telehealth, some of those requirements have been laxed during this crisis so that people can do other platforms that may not have been available to them previously. Also, the state of New Jersey has expanded their licenses for LPCs. So if you have a license in Pennsylvania, you can apply for a temporary license in the state of New Jersey to continue to see clients or new clients for 180 days. And then there's also an option to extend that for another 180 days. So you can check out their website as a way of also offering or expanding on your telehealth websites. So I would, if you are not already a member of PAATA, I would definitely check out their blogs that they have on their website. I believe those are accessible. And also in their My PAATA section or forum, there have been many discussions around different platforms that can be helpful in conducting art therapy sessions, and also just telehealth in general, that are both considered acceptable for HIPAA compliance and also resources.
Great, thanks.
Mm-hmm.
And
one more thing in our newsletter that just came out or is coming out, there's an article by Rachel Brandoff that talks a lot about making the transition to telehealth, and there's a lot of great resources within that article that also talks about how to conduct art therapy sessions, what are some apps and resources for that. So do be on the lookout of that. I know the article, because we had a lot of information, is towards the end, so make sure you scroll down to the bottom of your newsletter to check out Rachel's newsletter, her article that she wrote for us this month, or this quarter, sorry.
Yeah, that's a very rich article, definitely. Anyone else have either want to add on to answer Rhonda's question, or do you have your own share? You can share your concern, you can share artwork, you can ask for resources. Well, our work here is done. All right, thanks for coming, everybody.
There's a few chat messages. You might want to check chat.
Let's see if anything new came up. Okay. Is there a way to receive an update on where licensure efforts left off prior to being on hold due to COVID-19? Sorry, yes, we can share that. Is share screen a part of Zoom? Yes. Yeah, it's a part of Zoom. It's on that bottom menu, the bottom strip menu. Yeah, so we can give an update. Here, let me move this here. So the licensure update is we got our license accepted by the state House of Representatives. We got four sponsors, four co-sponsors, and then it was forwarded to the licensure committee. That's a subcommittee under the House of Representatives. Just as a reminder, there are two houses in our state government. There's the House of Representatives and there's the Senate. And so we were working in one of those chambers first, and which was suggested by our guidance from PAATA. So we were going down that road, and so our next step was to advocate to try to get that bill discussed and voted on by the licensure subcommittee within the House of Representatives, and then they would forward it back to the larger chamber for discussion and a vote. And as of now, as of when we took our pause, they still haven't taken it up for a vote or a discussion, so it's still been sitting in that committee. And in the meantime, we were readying ourselves to actually this spring launch a full-scale kind of assault, so to speak. Those are aggressive terms, on a full-scale assault on Harrisburg, meaning breaking out into smaller subgroups and having us go to various people on the committee to individually go to their offices and meet with them, convince them to personally co-sponsor it and to take this up for discussion. We also were doing a lot of preparation of materials. We have to have very professional looking leave behind materials after a meeting. So we created this very comprehensive information packet. It's very attractive. We developed, we also purchased this putty, PAATA putty that has like our logo on top, and then we were able to, so it's another leave behind. when we went and co-sponsored, we went and assisted the counselors with an advocacy day, and we saw that they had a physical leave behind as well. So we got our PAATA putty instead of, they gave candy. So we gave something that would nurture them for longer. So we were preparing all that during the winter, and everything was finally completely ready to go. And we planned a licensure subcommittee meeting, which was designed to literally take the next steps. And in those exact weeks, the whole shutdown happened. And so that next licensure meeting was really all about, what do we do now? You know, with the stay-at-home orders, also with government really focusing on all of their responses to the coronavirus, and making sure that, you know, all the different changes in licensure and regulations, that they've been working on that. And the third reason that we decided to pause, besides the obvious, is also just the appearance. It would look very tone deaf if we were, you know, gung-ho and saying, hey, you've got to let our little profession have a license, when there are people dying and they're working on trying to get, you know, protective equipment and testing and everything. So so all that being the reality and the backdrop, and one more little factor in the backdrop is that we only have about 7 months left of this legislative cycle. A legislative cycle lasts 2 years, and so we are in the downside, the second half of the 2019-2020 legislative cycle. There's going to be an election this fall, and there's going to be a complete changeover. So pretty much as of November, government starts to wind down, actually, and they do less legislative work, I understand. And then there's a transition as new representatives come on, other ones roll off. And so really the next legislative cycle starts in January of 2021. With everything going on, we knew that we were not going to be able to get in there and meet and effectively advocate for months, which was going to even shorten our time. And we still have to do 2 chambers, right? We still have to do both the House and the Senate. So we decided, for all of the above reasons, better to make a strategic pause for the world, for us, and we'll get back on it. We'll get back to planning in the fall, and then we'll have a full 2-year cycle to really to go at it. And we would need just everyone's support. Anyone who is at all interested in it, we definitely would love to hear from you. Please email the association, email the chapter. I forget the mailing address. It's on the website. Michelle, do you remember it? Or any other board member? What's our email address? I'm blanking on it right now. You can get it online on.
I can tell you, Mike. It's Megan. PAATA.org@gmail.com.
Thank you. Thank you. I have a faulty memory.
Laura just typed it into the chat box, so you can check it out.
It's in chat. Thanks, Laura.
PAATA.org@gmail.com.
Right. So that's the update. Anyone has any questions? We have
there's another question here about getting paperwork signed, also how people are getting paid.
Right. And before we do
that,
that, real quick, just was there any follow-up just about the licensure stuff? I don't want to be topic hopping too badly. You can unmute yourself with a question or type it if you have one about licensure. If not, then we can go to the next question. Okay. Question is, how are people starting new clients? For example, how are people getting intake paperwork signed? Also, how are people getting paid? Folks who have not previously accepted credit cards. Anyone doing this work? And
I can talk about what I do, but other people may chime in as well. I was doing this even before this happened, was that I would have a blank paperwork. It's both posted on my website, and then I would email it to the person in advance. And then through the GoToWebinar, we can upload more confidential materials because it's password protected. But other information, you could email it back, although I wouldn't include social security numbers, and I typically do not include bills that have diagnostic code or CPT codes or any of the more personal information in them. So those I would either send by regular mail or put in through a portal through the my GoToWebinar where I can put in handouts. You can also send out PayPal invoices, or if you use Square, you can charge people's credit card by either taking their number at the time of the appointment or at the end, or keeping a file of their credit card on file and then charging it at the end of the session. So I'm not sure what other people are doing, but those have been a couple things that have worked out for me and my practice.
I've used Zelle, where there's no exchange of credit card number, but the client has to agree to use Zelle and put their own number in.
Is it ZEL?
ZELLE. And it's for instance, if I have an account with Wells Fargo, with Chase, and so you set up Zelle for yourself, and then your client can easily set up Zelle from their own bank, but you never exchange those numbers with each other. And there's no fee. It's instant. After the first time you use it. The first time you use it, my recommendation is if you do it with a friend and do it for $1. It takes a few days, and then after that, it's an automatic thing with anybody that you use it with. So.
Okay. Thanks for that. Another option that we started at my practice is you can work it out with your bank, is to do electronic fund transfer. So they can work it out with the bank where if they provide you with their routing number and their bank account number, and their bank can wire it straight to you. There is a per transaction cost. I imagine it's going to be different for every bank. And I think ours is $1 per, so it's not so burdensome of a charge. It's $1 per transaction.
I think some other people might use Venmo. I haven't personally used it, but I know that I have had clients who've wanted to use it with me. But your bank cost thing is probably more cost effective if you can get it directly wired, depending on what the fees are. Certainly Square and PayPal take a percentage of whatever your fee.
Venmo is similar to Zelle.
Okay.
Okay.
I've been using Square, and I was using that before all this happened. I don't know that it is and for most clients, I won't hold their credit card. I mean, I don't keep that number. They'll give it to me. You can import it right into Square, and you can even save the card, but it is encrypted. I'm not sure if Square is actually HIPAA compliant. There's another place, but so much of those things are being relaxed right now, and I've never had a problem. I've been using Square for years. Many of the insurance companies, if you are a provider that's associated with insurance companies, you do have to ask, I've asked each client to double check whether or not their co-pays are being waived, because that is an issue right now. Many insurers, I know that Aetna, not every Aetna client is, not every Aetna contract is allowing for that. So I have 2 or 3 clients right now that do not have to pay any co-pays at all, which of course makes a difference for them because they definitely want to have treatment if they don't have to pay anything out of their pocket because they're not working. And others that do. So I put that onus on the client to go ahead and check that out. And if they don't have a response, then I am going to charge the co-pays. And typically what Aetna's been doing in the past is they'll just reimburse the client and take it out of my pay on the other end. Now for billing, Aetna does have a new platform called Avality, which is really a pain in the ass. If you are an Aetna provider, you need to learn that system immediately, because as of April 30th, the Aetna website will not be available to us to do billing. So that's just an important thing. Whoever you're contracted with, find out, what happens that website and what you have to do for those clients. Private pay clients are a whole nother story. I haven't been using Zelle. I don't really want to get anybody's bank numbers. I don't really want it routed directly. Although I think that that's fine to do. And I've certainly used it professionally with people. But I have 2 clients that I have insisted on using Apple Pay, which I don't really know that that's encrypted. I think what happens with Apple Pay is that they take money from their credit card and they put it on an Apple Cash card, and then they just wire that to me. So, they just do it. And there's nothing, I'm not going to undo it. So I have 2 clients that are doing that, which of course is great. But I have personally decided to waive all fees associated with any kind of contractual thing that I'm using, because I just, like, for example, to manually enter in a credit card for Square, I think is like 3.5%, something like that, plus a 15-cent fee. To manually, if you're in the session, it's like 2.5%. I'm on a Zoom. Okay, my husband's flying by here. Anyway, I just waive those things because I really just don't want to charge people another like $3.50 or whatever the heck it is. So I've just decided to do that. But it's worked out relatively well. The hardest part is just dealing with the websites and doing the billing, because one of the things I did was I did not enter the right code. So if you are billing through Aetna particularly, you do have to put the O2 code in for telehealth, and you must put the 95 modifier in there, or you will not get paid. And I can tell you, I am not getting paid. Every one of those sessions has been rejected. And once I can get the EOBs, I have to redo like 30 sessions. So make sure you find out about that before you do that. But, there are a lot of challenges with doing this whole thing, but at least I can provide support to my clients who are struggling, as am I, so yeah, hope that's helpful.
Thanks, Mindy.
Sure.
And just, did everyone get that? If you provide statements for clients for insurance purposes, or if you work with insurance companies, there's a special telehealth modifier. It's like a suffix. So you use your same CPT code that you would use for any treatment session, and then separately you then add after that 95 to indicate telehealth. So yeah, great. Thanks for those answers, everybody. There's a question in the chat about, is anyone else still working on site? If you are still working in an on-site setting, how are you handling that? How are you handling, I guess, your own health and keeping your art materials safe and clean?
Can you hear me?
Yes.
So this is Adele. This was and will be a big mess. I work on a psych unit within a regular freestanding hospital, and there's more and more news items coming out for freestanding psychiatric hospitals. And right in the very beginning, I was working feeling incredibly anxious and not wanting to go to work. And our administration, I felt, really forgot us up on the 8th floor. And I tried to have meetings. I tried to talk to our psychiatrist, who is our medical director. He would not even look at me. He would not even entertain a discussion about social distancing, telling me it was only for outside. It had nothing to do with inside the hospital. I didn't know how to separate the patients. I was, sanitizing, spending an hour a day sanitizing supplies. I wrote on Facebook. I wrote on the forum for PAATA. On Facebook, I did finally get a following of people that we've formed our own Facebook group, COVID-19 Inpatient Creative Art Therapists. And this is a pervasive difficulty of how to keep yourself safe, how to keep your patients safe. Mental health patients are often not compliant as it is, or adherent, and they're
not wanting to do things that would enhance their health. I only spent a couple of weeks on all this because then in the end, all three of our therapists, including me, tested positive for the virus. So I have not been back to work now for about 3 weeks. I hear that they are wearing masks now. A number of people on our unit have tested positive. I think it's a nightmare. And more people are going to get sick. And it's a scary, scary situation. And so having to do therapy in this kind of atmosphere is you are so preoccupied with everything else. How can you do therapy? It's a really horrible situation to be in.
Mm-hmm. Yeah, just impossible to work when you're worried about your own safety, right?
So I don't know if anybody else is on the call that's dealing with all this mess, but it's a mess.
How are you doing? Are you okay health-wise?
I'm at the end of it. I dodged a bullet, and even though I'm older and have asthma, I didn't have terrible symptoms. Actually, the younger one of us all, the therapist, was the sickest.
Oh.
It's just I'm trying now to get back my strength. I'm supposed to go back to work like in about a week and a half. So I need to be able to do all I need to do and have the energy to do it.
I hope you do.
Yeah.
Me too.
Adele, I'm so sorry that you've been through that. I know I've been thinking about you, and I know it's been really on your mind and scary, and I'm really sorry that that has happened. I wondered if you have looked into disability or even taking leaves or sort of workman's compensation based on your work contracted illness. I know that is another area, because I would have fears for you returning to work prematurely and becoming ill or not feeling fully recovered.
I am working with my primary care doctor. He's actually keeping me out longer than the Bucks County Board of Health would actually keep me out of work.
Mm-hmm.
They only require 3 days in a row of feeling
That's ridiculous.
as well as you did before you got this to go back to work. And my doctor is the one who is telling me I have to stay out longer than that. And I don't have the family leave and disability accessible to me now because just by chance I was out for 3 months from surgery last year, and it's within the same 12-month period, so I can't restart all that till August. So I do not have any of that at my disposal right now.
I wonder if under these circumstances there would be exceptions. I think there are a lot of people that are looking for sort of legal recourse based on workplace injury. And so, we can talk after this call more about details if you want, but it certainly seems like it's a work hazard, and it would be something that you had contracted in the line of your work. So I would think that workman's compensation would be an avenue to explore, which would be different than a Family Leave Act or something else. Workman's compensation would be an injury sustained at work.
Perhaps there is. But even for people who have, were given masks or whatever in the beginning, I'm just wondering how people are dealing with just the sheer amount of time in dealing with sanitizing everything you're trying to work with in time for the next group. It's overwhelming to try to have enough supplies to work with in a group that you feel are safe to hand out. I don't know. Is everybody else not in this position?
Rebecca is signaling. Yeah, go ahead.
Yeah, so I can speak to that. And Adele, I'm glad that you're managing okay at the moment, and I hope it works out for you. But I wanted to speak up because I also work in patient psych. We have 3 units, 2 adult units and 1 adolescent unit. We're still considered essential staff, so they're expecting us to provide groups at the moment. So that was really scary for all of us. And every day that I would come in, I work part-time, but every day that I come in, it would seem like there was a new expectation and a new rule and new something to adjust to, which has been really difficult. We've had to redo our whole schedule. I work in a department with, we provide the programming, and I work with occupational therapists, recreational therapists, and all of us use stuff. It's all items. And so we've all had to figure out what can we sanitize, what we can use, what we can't use. And it's changed everything. We changed our schedule because we had to have no more than 10 people in a room at a time. So whereas before we may have had half the unit or all of the unit in with us to do a group, we've had to break it down into small pods. And so there's no more than 10 people at a time, including staff, or if a patient is on a 1-to-1, all of those people get counted. So the patients are getting fewer groups than what they've had before, but that's just because logistically, the way we've had to break it up with the number of staff that we've had, that's just the end result. So that was one change. We are wearing goggles, we're wearing masks that the hospital has provided. And like you said, we're sanitizing between every single group. So I sanitize the room, the tables, the chairs, the light switches, the doorknobs, anything that might get touched. Once the patients leave, I have 15 minutes in between to sanitize everything again, only what was touched, you know, so I'm always paying attention what chairs were sat in and which ones weren't, because I don't want to make more work for myself. But doing all that in between, we try to help each other. As other groups are going on, we try to help each other. We try to enlist the help of the techs and the nurses if they have time to help us. Sometimes it happens, sometimes not. But it's a lot. It's really definitely a lot. We use wipes, we use sprays and rags, and just to wipe everything down. As far as art supplies, you know, you hope you're doing the right thing. Markers, I feel like I can wipe those down. Pencils, I feel like I can wipe those down. I don't use clay. I've had to give up some things that I normally use.
Yep. Mm-hmm.
And even the time allotments, because the schedule has had to change. I don't even have the time slots that I've had before. So it's also working with that limitation as well. But crayons, pastels, things that you can't really wipe down. I've read that the virus only lives, you know, a certain amount of time on those other kinds of surfaces. So things that I can't actively spray and wipe down, I might only use it once a week or once every 10 days. And my thinking is that hopefully in that span of time, nothing is living on that surface anymore.
Right, yes.
So I'm hoping that's the right thing. That's the mindset I have. But yeah, I've had to change everything, and it's been incredibly stressful. I've had dreams about it. You know, it's a hard environment to work in. And when you have patients then coming onto the unit that you find out later were testing positive and they're not wearing masks, because now the patients are wearing masks as well, but they're playing with them and trying to speak over them. And it's really hard. It's really hard. And also the social distancing. You know, we're trying to stay within 6 feet away. We're trying to communicate this therapeutic spirit when you're speaking to them through the mask and the glasses and really far away. It's hard to get that climate going. But I think once you can engage with someone in the moment, some of that disappears, you know, is all I can say. If you can kind of keep coming back to the artwork, use music, use other things to help create that environment, some of that it's kind of like a new normal. I think it was worse in the beginning, and each week that goes by as we've been doing it, it feels like a new normal, and it feels like you don't really see the mask anymore. Before it was all I could see, and now I'm at the point where I feel like I can tune into the words more than my frustration with, I can only see half their face. So it does get better over time. Not that I like it anymore, I don't. But it's hard. And like you said, on the unit, you know, patients are still sitting next to each other on the couch trying to watch TV, and they're giving each other hugs goodbye when somebody gets discharged. And, you know, you can tell them over and over again, and either they forget or they don't care, or they minimize what the risk might be. But it's a challenge. So there is an ongoing anxiety all the time.
Yeah, I agree.
Yeah.
Adele Cara wants to talk to you offline at some point, so I'm going to have her send PAATA an email and connect the two of you by email.
Okay.
She wants to support you in an offline conversation.
After the meeting's done?
Another time, yeah. So
Yeah, okay.
And if you guys by email afterwards.
That's fine.
I also wouldn't mind talking now, but I didn't know, Mike, if that was more so for the interest of time.
No, this is the forum to do it.
Okay. So then I can speak to that now.
Okay,
I'll
great,
try
great,
to
great.
keep it as succinct as possible. But it sounds like I'm also in a very similar situation to Adele and Rebecca, who just spoke. I am the director of a partial program, but we're quite unique because we share our facility with 2 residential programs, and we're all part of the same agency. So there's a lot of pressure from higher ups that since we're the people with the therapy, and the backgrounds and the experience, that we're there to help support not only the clients, but that we're there to kind of provide some support to the direct care staff that work on these units as well. But I mean, it's been a constantly evolving day-by-day situation. I think the past 2 weeks have been the most trying, and fortunately I've had 1 staff member get tested so far that was negative, but I'm kind of waiting for the ball to drop as far as what happens once we have staff testing when we start having staff testing positive. We do have clients in the building that we do have confirmed have tested positive. Even though there's a huge separation between the floors, and we are now all programming on the floor that there isn't the outbreak on, there's still the potential that it's somehow going to get crossed over. So I mean, it's definitely still a very real daily concern about everybody's safety. I had a staff member call me today. I got to call him back. I'm like trying to keep people in communication as much as possible. And as far as what I really wanted to speak to, Adele, I'm by no means an HR specialist, but I've been in contact with my HR department a lot because I've had so many questions come up. And my understanding is that, and this could be helpful for others as well, that if there's FMLA used, I think that there's also this intermittent FMLA that could be potentially tapped into for separate reasons. So if somebody needs to use FMLA time, even if it's within a certain now this might also differ by agencies, I'm not 100% sure. But my understanding is that if somebody has used FMLA at one point in the fiscal year but needs it for a completely separate reason, that there should still be some kind of allowance or wiggle room as far as that goes. So it might be worth asking explicitly about does your company offer intermittent FMLA? I think that's part of like a federal program and should not change drastically between agencies or anything like that. But that's been really helpful information for me to have, and also for some of my staff, because I work with I happen to have about half of my team has compromised immune systems. And that's not something that HR knows. That's stuff that I know because I have such a rapport and relationship with each of my staff members. So HR was shocked to hear about how many people were calling out and needing to be out. And I said, no, I'm not surprised. I expected that. And, we're going to continue doing what we can to support the people that we can and do the work that we do. So, I know it feels like you're very alone, because that's very much how I'm feeling. Like I feel like I'm on this island. And that was part of the reason that I was like, you know what, let me join this town hall and connect with other people that are going through similar things. And a lot of the difficulties and frustrations and all of my feelings, I'm not only holding that for myself, I'm holding that for my whole team. And so I think that's that for me is even more difficult, is I'm not just managing my own anxieties, I'm managing the anxieties of 12 other employees. So.
It takes a lot of emotional strength, endurance to show up and for yourself. Let alone to be able to hear everyone else's concerns and worries and fears and all that. So.
Yeah. All right, thanks.
Thank you. this definitely speaks to our need, to do self-care, and I hope that everyone's doubling down on self-care during this time. I know personally, I've had waves of every emotion under the sun that were, I can't CBT out of me, there's the lived experience of going through this. So I don't know if anyone else wants to comment on that, or let's see. And there's one other thing that came up in the chat. This is from Cheryl, who works with Art Expression Incorporated.
Yeah.
And I don't know, Cheryl, can you maybe mention that actually?
Yeah. Couple of things. I'm an art therapist from Pittsburgh, and I am on the board of Art Expression. I've been working with them for many, many years. So I'm a program developer, and we started after school. We also work at the homeless shelters. So obviously all of our programs are at a grinding halt. And our partner providers, we're all grant-based. We don't charge our families or our kids or our participants at all. We're 100% grant-based. So all of our grant funders are now challenging us to make everything virtual and make it all safe. So what I've been doing for even my own process, I'm a homeschooling mom. My daughter was premature, so she's been trached and vented. I know how to work a vent. I know how serious this disease is. So for me to be able to process that with my daughter, who understands what being in the hospital for months and months and months being sick is like, she actually decided to create a comic book about it. So for our own kind of process, we ended up using Legos and using storyboarding, and she created a senior squad comic book. And her superheroes are actually the elderly. And I have that on my Facebook page, and I'll see if Angela wants to share it on Art Expression. But I've been using Caption, I've been using Flipsnack, I've been trying to figure out how to do this, and then I'm going to start training others how to do this. So that could be a really fun, like if you have adolescents that love comic books, if you have kids that you work with already who love that medium, it's going to be a great storytelling medium for them to just express what's going on. Tell us a story about the virus. Tell us what you're experiencing, or who's going to rescue us from this. So from that springboard that I just did as a homeschooling exercise, we're now doing this comic book, and we're spreading that around. And then for work, I started using Venngage. Have you guys heard of Venngage at all?
No.
It's an infographic program, makes really pretty little worksheets. And I decided to do an activity roundup. I just took 4 activities that I know are tried and true and relevant. And they're also on our Art Expression Inc. Facebook page. I don't think they're on our website because our web developer is too busy to help us. So it's on our Facebook page. We are going to be launching those, I think, every week, a different one. But when Karen Pence's office saw our newsletter, they actually, the very, I don't know, couple hours later, we got an email from them, and they asked, wow, what are you guys doing? How are you going to support the shelters? How are you going to support the schools? What are you guys doing? And they love the idea. So I'm kind of like, okay, ask her for funding then. Like, what do we do next? But the NEA is actually extending a new grant for anybody who is already an NEA grant holder. So now we have the opportunity to make 12 art therapy type videos, art and music facilitation videos. And that's kind of where we are next in that phase of getting that funding and that support, because we do art. I don't want to call it art therapy, it's art facilitation. 100% of us are art therapists or music therapists. So it's a way to provide very similar services, except we don't do diagnostics You know, we don't get into super deep personal stuff all the time. We don't ask for that information. But as you know, art is therapy. The art access therapy, we help social emotional learning. We try to keep it very academic enrichment focused. But there's constant debate with Dana Ellendorf, especially, is like, you do art therapy. It's just a different platform. It's a community platform. You know, we work with parents and children. That's my new program that we launched this year, where I get to spend an hour with parents, taking them through the activities that I'm going to do with their kids. And then we bring in the kids, and then we all do the activity together. So if it's a storybook and then an activity, I had the mom say, okay, now you're the teacher. Now you read the story, and now you do the activity engagement. So kind of giving them that scaffolding approach of, I'm still here with you, but I need you to be able to do this on your own, because I only have a couple sessions with them. So I work in a different way than, you know, the telehealth or the one-on-one. That's not what I do anymore. I really am in group. And this whole thing is such a challenge, because I am not willing to risk my life or my kid's life going in with a little mask and having to sanitize. There's no way I'm going to do it. So my task is figuring out how to make this safe for every therapist who contracts with us, and how to keep it safe for our participants, because this isn't going away anytime soon. And you know, from ShelterWorks, they're working in small spaces. There is no way we can do 6 feet apart.
Right.
In schools too.
Could you type into the chat some of those comic book making apps that you use?
Yeah, sure. Yeah, I can share with you. Is there a place to post the actual, like, I can link it? I made it on Caption and then FlipSnack. Like, I can actually link it, and you guys can like flip through the whole thing.
Sure. If you just type the link or paste the link into our chat, then everyone can have it. In fact, everyone, Michelle,
how to do that.
If you go online and just, you know, find whatever the link is to your, you know, in your web browser, copy it, and then come back to this screen and then paste it into our chat.
Oh, okay. I can do that.
Yeah. Michelle Dean put in a link for information about FMLA with a link for that, so you can all check that out too.
Yeah, just make sure that the link is to everyone when you put it in, and then everybody will be able to receive it and then copy it out of the memo.
Okay. Right.
Thanks.
And what Michelle means by that is, you know, there are options that you can select an individual person to
yes,
or everyone. So I'm telling everybody, just so you know. Try to click on a button that says, you know, chat with everyone, which is the default. Okay, thanks, Cheryl.
You're welcome. I hope that helps, because there's I think it is exploring for all of us, converting to virtual, especially when you work in groups. It's just like mind-blowing, like, how are we going to do this? But I've seen really good examples, so I'm hoping that what we're going to do is enough in the meantime, and that's all we're going to hope for, really, because I don't want to be in the situation of other people are in with getting sick. I don't know that it's worth it for anybody to continue doing that.
Right. Yeah. Thank you.
Yeah.
I think that brings up a good point that a lot of people are struggling with in terms of, you know, the whole country is in the throes of this, about finding sustainable, life-supporting work so that they can pay their bills and do what they need to do in terms of feeding their family under these stressful circumstances, and still, you know, finding a way to keep them safe. Obviously, when you make the equation about if you don't have your health or your life, certainly finding meaningful work and paying those bills does not seem as important. But in the day-to-day, I think that's a huge struggle for people. I think there are also other government-supported resources out there for people, if you're not aware, from business loans to unemployment. Even if your unemployment if your work is reduced rather than fully unemployed. There are also more opportunities for people who are self-employed, whereas in the past, self-employment was, even though you paid for it, you were never eligible to collect on unemployment as a self-employed person. There are provisions that are now coming out that will allow self-employed people to collect unemployment, which you've been paying into. So there are, some government-supported resources as well. So I'm hoping that that will help mitigate some of the struggles.
Right. We can't underline that enough, actually. If old regulations where you had to be, identified legally as an employee to get unemployment, and that's been waived. So now, under the coronavirus, people who are self-employed or who are independent contractors can now get some amount, whatever that percentage is, of financial support. So go online and go on to, it's Pennsylvania, it's not national. So you have to go to Pennsylvania unemployment.
I'm just wondering if anybody's had any success with that, because in truth, those things sound great, but I don't know a single person that's actually found to be qualified for it and getting the money.
Some of them are not funded fully yet. Some of them have already spent, apparently from what I understand, have already spent their whatever allotment that they had in there. They already were tapped out. And so they were ineligible for that as well. So I think the ones that are not yet funded yet is hopeful. But yeah, that you bring up a good point, Stephanie.
I mean, I know that we applied for the $10,000 disaster loan, which is an advance, and you hear nothing back. So this is an area that I feel like they're saying one thing and it's really not happening. Not to be a downer for everybody, but I want to be realistic. On another note, one thing that I could suggest, and I'm talking to my students about it, is to set up a buddy system with somebody who maybe you wouldn't necessarily think of as being your buddy, but just somebody that you can talk to every day online, just for a few minutes, or on the phone or whatever, that you check in with. And it actually helps if it's somebody who's not associated with where you work, but rather, just spin the dial and pick somebody and ask if they'll agree to do that with you. Just to hear a voice that's a little bit different and to feel connected.
Yeah. For sure.
Thanks, Stephanie.
Mm-hmm. We have no new questions or comments in chat. Anyone else have anything that you're going through? Anything you want to ask? Kate had her hand up. Their hand up.
Hey everybody. I'm a second year decelerated student at Drexel University's Creative Arts Therapies program, and I was wondering if there was any work either through PAATA or through like just things you've heard of independently on like ways to support art therapy students in this time. It's been really challenging because our clinical education program has been suspended, and we are not right now collecting hours except for through some activities like this and some other independent study and treatment planning activities. But I'm just kind of trying to like get an idea of like if there's anybody out there who's already like kind of like gotten some support from like supervision or from other sources, that any words of advice that you could share with us.
That's a really, really rough situation. I know at Marywood, we are running our group supervision through the end of the semester based on, of course, what the students have been able to do up until the point where they couldn't see clients anymore. We've also, and we do those synchronously so that we can see each other. We've also been doing a survey of all of our sites to see which ones would offer telehealth opportunities for our students so that at least we can get a small cohort of students that would be able to continue to do their practicum and internship experiences. But it's really a rough situation, and we don't know what the summer's going to look like. And I think that's something we're all like chomping at the bit trying to figure out. Will things be opened up for that, and will it be safe for our students? I don't know, Michelle, did you?
Yeah, I'm at Cedar Crest, and our summer internships are suspended. So in lieu of our summer internships, we are doing a different elective online. So, and halfway through the semester, our internships were also suspended. We have reached out to the ATCB on a couple occasions and also to our accrediting agency just to get clarification. So far, the ATCB has not backed down from their language and their standards that say direct clinical hours. There's no provision, even though we've asked for clarification as to whether or not online hours would even be sufficient. And then that brings up the question as then if we had some people that could do remote telehealth, as students, who would oversee them? What would be their platforms? How would we protect confidentiality if the students are in their own homes? So there's a whole host of other issues that we've been taking into consideration but don't have the answers for. What I've been telling our students who also had, are going to, the ones that are currently enrolled in internship are finishing out the semester doing their case presentations for the programs that they've already had. We're also looking at creative ways of writing case studies or doing other case programs or case presentations based on fictional characters in film or literature. So we are taking a hiatus. And so for some of our students, although, obviously this is not what we would want for them or what our original course of study is, it may be that our students have all but internship, sort of like PhD students have all but dissertation. Until we can safely return them, because students are neither essential nor are they employees. I think our number one priority for our students is certainly their health and well-being, because continuing an education program that would jeopardize that would, in my opinion, not be worth it. So I would definitely err on the side of protecting your health and well-being. You will have an opportunity to be in the workforce and make a difference. I just wouldn't want to do that at any cost to students. But I know that Drexel in particular, I know is taking, reaching out for funding and donations and for their student funds. So I don't know if they're putting together monetary plans for that. I know that our college also has monetary funds for students who are in need. And so it's, this is a fluid situation, and because we don't know everything there is to know about this virus and how to protect ourselves from this, either through treatment or vaccination in the future, I think it, and this applies to pretty much so everyone, is that we're just going to need to take all the precautions that we can to remain safe and protect our students. So I know it's frustrating. It's a frustrating situation for all, and unfortunately, there's no clear return path at this point for our students. So,
Michelle, is it your understanding that as of now, the ATCB is not considering telehealth to be valid for internship hours, or is it still up in the air?
The ATCB, we have asked for a clarification of that. So they have reiterated their requirements. In the past, they've never allowed telehealth to be a part of the direct hour accrual. So they reiterated that. We wrote back again asking for clarification if they would be willing to change it. We have not heard back otherwise. So instead of attempting to find internships that might be able to support some and not all, until they offer some clearer guidance, we are not going to pursue telehealth at this point. One, I don't think we have the infrastructure to do that and two, there's a lot of logistical questions as to how to provide supervision of our internships through a telehealth means with the clients. So that would be a whole, if they do allow that, that will be a whole nother thing that we'll need to explore about how that can be executed safely and confidentially.
Michelle, thank you for that clarification about ATCB. I actually wasn't aware of that they were not going to allow those telehealth hours. And I really appreciate this. I'm appreciative, Mike, that we have this group, that we're talking about these things, because, that was like a blind spot for me. And now with that knowledge in mind, I'm going to have to go back and revisit what I stated earlier about the telehealth.
Now, they may come back and say that they would accept it, but at this point, they have not given any sort of verbal indication that they would be willing to do that and how they would want to see that executed. And I imagine they'd have to come up with some sort of policy. All I got from them, and I think they reiterated that to all educators, was the same thing you probably got too, which is the same standard that they hold out there for students.
Right, that's all I got, but I didn't look deeper into it than that.
I know other schools are interpreting that differently, but my fear would be that if some are and some aren't, when they get to the end, if the language hasn't been clear, they could reject all of those hours and the credits that the students had enrolled in, which would then make students ineligible for their credential, which is the whole point of, continue with their education. So until they can offer more clarity or some very specific language under these circumstances, we are suspending our internship hours until we can find a way to do so safely for now. So again, and I've been telling our current and our incoming students that, again, it may be like all but internship that students are able to move through the program.
Okay, I'd like to back channel you on this to discuss further and working together on that.
Yeah, maybe you'll be my buddy. We can call it.
Let's be buddies. Okay.
I'd like to be a part of that conversation too, because I'm teaching the group supervision course at Holy Family, and they're still counting the telehealth hours, and that's coming from higher up. And there's not really an art therapist that's in administration that's able to really double check these things. So I'm glad that I'm getting this information now. And so I'd love to be a part of those conversations too.
Sure.
Okay.
Is there a, Jed, are you trying to leave?
No, I'll wait my turn.
Okay, I just have a question. Is there any kind of like a regular meeting among the grad school program leadership, like especially now just to touch base, because you all could really enhance each other's planning? Someone could have an idea that another program doesn't know, that hadn't thought of, but if you're not communicating, it's very siloed.
I agree, and I that's what I wanted to talk with you about. And also, it may help if we're all on the same page, because then, there's strength in numbers. So I would like that.
Okay.
So I'm curious, there was a comment that supervision is running at Seton Hill for those in clinical internships. Does that mean that you're still sending your interns out into the field?
Hello. Hi. My name's Katrina. I'm a student at Seton Hill. We are still going out into the field. So I work, I'm doing my internship at Holy Family Institute in Pittsburgh, and I do still go in once a week.
Wow.
Wow. When I spoke before, I didn't mean, when I said the course was still running, our students are not allowed to go into the field.
No.
Same with us.
Yeah, because they're considered non-essential and they're not employees.
Right.
So I'm surprised that that's the case.
There was another chat. I didn't know that telehealth was not PAATA approved. I believe that art therapists in private practice are operating under their LPCs.
So that's what we're talking about is different. So you can certainly do telehealth as a practitioner, and the Art Therapy Board, the Art Therapy Association does have some provisions for that. The LPCs are also, they have some provisions for that. What we were speaking about is for the ATCB, they do require a certain number of hours of direct clinical experiences, and a certain number of those must also include direct art therapy. The word direct has not been differentiated to specify whether they have to be face-to-face, which has been the assumption thus far because that's how internships have always run. But they have not given any sort of disclaimer or guidance related to telehealth. So without that, it would put our students at risk of continuing on not only being exposed, but two, if they had to go in person, but two, if they would accept those at a distance or telehealth hours. Direct and telehealth may not be synonymous. And so without clear languaging from the ATCB, I would hate to have our students go all the way through our program doing telehealth clinical hours without them accepting them for their credential, which would need to be signed off on after they finish, their 100 hours of postgraduate hours, and then, say that their educational hours don't count. So
that actually raises a point outside of RAD programs, which is, ATCB, is in charge of LPC, is in charge of the ATR hours.
Correct.
They're not allowing telehealth for students. I wonder if they would disallow telehealth hours if people were trying to use them.
Yeah, they're not specifying that either. Historically, telehealth hours have not been allowed for ATR hours either. So, and all they've done is reiterate their current standards. They've not made any specific languaging, even though I know and other graduate school directors have reached out to them, and then they sent out a general information or general email to all saying that they are basically just sticking with what they've had.
Right.
So it may be that, enough people continue to put pressure on them to define their language, that the board for the ATCB will need to change that, or at least make some exception or clarification. But at this point, they have not done that with the initial pressure from the graduate school directors or others.
Yeah. Wow. If you're an art therapy educator, do you want to set up your own group educator chat, or do you want to have PAATA reach out and sort of facilitate that?
We could do that. I know I've reached out to some other ones, and I know that there are groups that are online that are more of like discussion boards. The Kate group, which is a Google group at this point, not a Yahoo group. So there's been some discussion there, but yeah, it would be good to sort of unite and continue our dialogue. So maybe we could facilitate that in the state of Pennsylvania.
Okay. Right, got it. Everyone, it's about 3:26, and we scheduled, I'm sort of playing the role of timekeeper, about 4 more minutes. Let's see. So
Jet was going to say something.
Jet was going to say something. Thanks,
I had something to show as for closure. I actually have some photographs on my desktop that I'm using. I've done a journal every day. So there's like 25. It's called my sequestered series. And so I would love to show them at the end. So as a final,
great.
I will leave you with, some, I think, beautiful photographs.
That's great. Let's see if anybody else has questions, and then we could end on that if that works for everyone.
Let me just quickly, let's check the chat real quick. Let's follow up. Anyone know about websites? Does anyone know about websites about honing your art therapy counseling skills? I know there's this one professional training company, PESI, P-E-S-I, a little bit controversial because they've had some non-art therapists claiming to be art therapists in the past, but they have had discounted and or free postgraduate training, CE trainings. So go on there and explore, and they've been rotating different things. So I can't tell you specifically, but they're often different. It's not always art therapy specific, but they could be like diagnosis or population specific. So that's one resource.
But you know, there's PAATA has their ICE courses, which are online courses that you can get your CECs. I know our company, the Center for Psych and the Arts, has a few online courses because we're NBCC providers. And there may be other ones as well, like psychotherapy.net is another one that you can watch their videos and fill out a post-test. Those can be helpful as well. Those aren't necessarily art therapy specific, but the last one, the psychotherapy.net, but some of the other ones that certainly at ADA and our business and other places too.
Yeah. Michelle, is the psychotherapy.net, is that the psychotherapy networker?
No, that's different. So psychotherapy.net, if you have Canopy or can stream them, you can do that. I think it's, I get emails from, I think it's PNG or something like that. But I think you can, if you go to psychotherapy.net or through some of these other, psychotherapy, oh, I don't know, let me look it up real quick on this other computer here. Anyway, you can, I know, I'm pretty sure that's what it is. PGN.
Michelle's pulling it up. Well, Michelle, does that, in the interest of time,
yeah.
The one thing, question, how about clinical intern hours counted towards LPC credentialing? That is never going to work because your LPC credential hours only begin accruing after graduation. So if you have intern hours, that only is for your grad school program for your degree. Then it resets. You start from zero once you graduate towards LPC and ATR. Yeah. All right, that was the last question, and we're right up against 3:30. So let's see if Michelle, did you?
I have to look. I know I've had a ton of these things, but I can't seem to pull them up quickly here.
Yeah.
If I find them, I can send them out. I get them off, maybe PND.
Everyone also check out the Psychotherapy Networker. I think they have a website. They do a conference with a lot of like kind of bigwig counselor psychology and marriage and family therapy presenters. And I don't know, they might have some online CEs as well. I haven't checked their website in a long, long time, but anyway, that's all the time we have. So we'll go to Jet's little visual. She's going to share it now. We can do this again, maybe in a couple weeks, and come together again. So we'll get the word out. And everyone, just so you know, at our peak, we had 45 people on with us today, which is a really nice sized meeting on a Sunday, given everything that's going on. So it was really special to have you all together. And we're glad that we can mutually support. So this was really, really special to experience on my end and a little bit uplifting. So thanks for raising my spirits today.
Thank you, Mike.
Yeah, you're welcome. You're welcome.
Great.
So, okay, we'll put out something in the next couple of weeks, and we can, are you still slideshowing us?
Yep.
Okay, cool.
Are they up there?
Yes, we have the black and white window image.
No, maybe they just have to go one at a time. But they'd all be up.
Do you have them in a PowerPoint? Because then you could scroll through them.
No, they're just on the screen.
Oh, so you're just going in and out. Okay. So.
Okay, well.
I can leave the meeting running, and people can hang if you want to hang and see images.
No, that's okay. I thought they were just going to all show up at once, but they didn't.
Okay.
Next time, Jet, you could put them in a PowerPoint and we can scroll through them.
Yes.
PowerPoint, yes.
Everyone, so we did record the meeting. So we'll find a place to post this.
Jet Sarah on Instagram, you can see them all.
Okay, Jet Sarah.
Just Jet Sarah, JETTSARA. Thanks, guys.
Great, thank you.
Great to be together. Be safe, be healthy, and we'll connect again soon.
Great. Thank you.
Thank
Bye
you.
all.
Thank you.